Did was I thought I was doing all the healthy things. I gave up a lot of steak and roast and pork and ate chicken and fish instead. And I ate white meat chicken breast. Well, I didn't know that a white meat chicken breast has just about the same amount of cholesterol as a T-bone steak. I had no idea. And I was a cheeseaholic. Not only did it give me much more sodium than I needed, but it was giving me 60 or 70% of my calories from fat, when now I'm only at 10% of my calories of fat. It was cheese and the other foods were plugging up my arteries and sending me to the hospital. What one of the doctors said was very apt. He said, "You've got one foot in the grave and the other on a banana peel."
His cardiologist told him he needed emergency bypass surgery or he would die. He decided to save his own life by walking away from that surgery.
And they said, "Well, you don't want this life-saving procedure?" And I said, "No, it's against my religion." And they all looked at me very quizzically and said, "What is your religion?" And I said, "I'm a devout coward." So with that, against their advice, I went home to learn about how I could repair the damage myself and do something on my own to reverse the heart disease. And I did.
After leaving his surgeons behind, Dr. Pinkney began reading books on reversing heart disease and changing his diet.
My angina, the pain that was so severe, within 2 weeks it was almost all gone. Within 2 months it was completely gone, and I started walking up. I couldn't walk 200 feet without severe pain and have to sit down. And just 3 months later, I was walking 2 miles up a steep hill with no pain. 7 months after I started this program, I finished in the middle of the pack of an 8.2 mile Great Aloha Run, and I had never run a race before in my life. But I changed overnight. I mean, not only did I go to avoiding all animal-based foods, but I stopped dairy, milk and all milk products, and eggs and egg whites. I went completely plant-based. And that's, I think, going completely helped clear up my allergies and make me feel better. I lost 45 pounds, and I was a 38 waist. I'm a 32 now. I never felt better in my life. I had more energy. I didn't fall asleep after lunch. I didn't have all the aches and pains that I had had before. To give scientific evidence, I've had 3 more thallium scans. I've had a MUGA scan, which is another way of showing how much blood goes through the arteries, and I've had a scan, a CT scan, and all of them indicate that my arteries are cleaner than most 21-year-olds. I went back a year later after I had had this wonderful reversal of heart disease and looked and felt so much better, and I went to go see the 4 cardiologists that told me I was going to die within a day or 2 if I didn't have the bypass. All 4 were younger than me. 3 of them were dead. And the other, who was the chief of cardiology, was so amazed, he couldn't believe it, that he started sending his patients to my support groups instead of to bypass surgery. I conducted 75 heart reversal workshops or support groups, and over 50 of the people who came to those groups were scheduled for bypass operations, and none of them had to have them after 10 weeks. 99% of the people who are scheduled for bypasses shouldn't have to have them, as long as they're willing to make changes in their lifestyle. They have to exercise. They have to take out a little time every day to make sure they exercise. They have to change their diet. They have to lower their fat, and they have to take plant-based foods instead of animal-based foods. That seems to be much more sensible than having a stent put in, which will close up again if you don't change your lifestyle, or a bypass operation which will plug up again eventually, maybe in a year, maybe in 5 years, but it's going to plug up again unless the lifestyle is changed. The Atkins diet causes a toxic reaction, and as a result, you may lose weight temporarily, but the research is very clear. People who lose weight on Atkins-type diets gain it all back, usually plus some, within 2 years. Plus, they've also plugged up their arteries and filled themselves full of free radicals, which enhances their chance for cancer. I think it's very foolish to do that. I can eat steak and eggs and bacon and chocolate cake and vanilla ice cream, and I'm going to get better and I'm going to lose weight. I mean, it doesn't take a nuclear scientist to figure out somewhere along the line that doesn't sound right.
Not only does it not sound right, it doesn't look right either, from inside your body. This is a blood sample from a man who just ate 2 staples of the Atkins diet, a cheeseburger and shake. So it shouldn't come as a big surprise that high-fat diets, such as the Atkins diet, cause a whopping 40% reduction in blood flow to the heart after just 1 year. Dr. Esselstyn is one of the world's leading experts at treating heart disease. He says heart disease can be stopped in its tracks and reversed by adopting a simple plant-based diet. He should know. He's conducted the longest and most successful heart disease reversal program ever.
Well, the American Heart Association is recommending presently that you maintain a cholesterol under 200 and the dietary fat in your be less than 30%. But if you look at people who are consuming a fat level of 30%, not only have we never seen regression of disease at that level, but indeed there are studies that indicate there is progression of disease at that level. So literally, if you follow the guidelines of the American Heart Association Step 1 diet, it literally guarantees that millions of Americans will continue to perish from this disease. What happens when our nutrient support comes from foods that not in a decade, or not in 2 decades, or not in 3 decades, but eventually will cause us to be ravaged by these disease conditions that really occupy about 70% of medical therapy that we see today. We know now from data that we have that through the so-called brachial artery tourniquet test that with a single needle you can demonstrate the endothelial injury that occurs to the vascular system. And that's the problem with today with the most well-intentioned internists and cardiologists, that you're only having roast beef once or twice a week now, no longer regularly. You're only occasionally having chicken. You're eating less cheese, you're eating less cream, you're eating less butter. And as a result, instead of pouring gallons of gasoline on the fire, you're pouring quarts of gasoline on the fire. And as a result, the fire doesn't go out. This isn't cancer. It's a completely benign disease. And it's absolutely something that should be annihilated in its tracks. This is tremendously empowering for the patient because the patient has become the locus of control, not the cardiologist, not the surgeon. And it's so reassuring to them to think that I am in charge of this disease that previously was trying to destroy me. Not only do you escape stroke and heart attack, but this also would include obesity, hypertension, adult onset diabetes, and the common Western cancers of breast in the female, prostate in the male, and colon in both. So I think the spin-offs here in terms of overall health are extremely profound.